Okay, so we were talking about these homeostatic mechanisms that keeps blood pressure and volume where they need to be. And again, do look back at the figures, module 19.11 and 19.13 to look at some of these factors that are involved. Let's talk about what happens with shock then. Okay, because you can go into a real acute cardiovascular crisis, and this is related to when you have really low blood pressure or hypotension and inadequate peripheral blood flow. And usually, as you might imagine, it's caused by losing way too much blood, so hemorrhaging or some kind of heart damage like in a heart attack. And unfortunately, during these times, your normal homeostatic mechanisms don't kick in, so they don't compensate for the problem. And you go into circulatory shock, and this is a positive feedback loop that begins when blood loss is greater than 35%. And as you might recall from 168, there's very few cases where we talk about positive feedback loops. There's only two we've talked about before really were blood clotting and childbirth. Okay, so we have this progression here. We have progressive shock, where the blood volume drops by more than 35%. And that happens despite any sustained vasoconstriction and any mobilized venous reserve. So what your body is trying to do is to increase the blood pressure by constricting the blood vessels and bringing whatever reserves of blood are available. The blood pressure stays low, the venous return is reduced, and of course your cardiac output is inadequate. Then low cardiac output is going to reduce blood flow to the heart, and you're going to have damages to your myocardium because now you don't have blood supplying the tissues of the heart itself. And that leads to further reductions in cardiac output. Then reduced cardiac output is going to accelerate your oxygen starvation in the tissues. Local chemical changes will promote any intravascular clotting. And that is just simply going to restrict the peripheral blood flow even more. So this is the positive feedback loop we're talking about. And then local pH changes will increase capillary permeability, and unfortunately that further reduces blood volume as well. The carotid baroreceptors trigger vasomotor centers. Then the sympathetic output is going to cause widespread vasoconstriction. This reduces your peripheral circulation, but it's going to increase the brain blood flow temporarily. It's kind of like a last-ditch effort to preserve certain areas that are vital. Without any treatment, the blood pressure will again decline. The heart now is seriously damaged, and the cardiac output declines even more. We go into circulatory collapse. This happens when the arteriolar smooth muscles and the precapillary sphincters can't contract. And it leads to widespread vasodilation, immediate and fatal decrease in blood pressure, and your blood flow ceases, stops. So this is a good graphic to remember. And now we're going to talk a little bit more about the patterns of blood flow. And we'll work with the clinical module at the very end. Okay, so when we're forming blood vessels, we call this vasculogenesis. And you've probably heard that term used before. I'm sure you've heard the term genesis used in other parts of the anatomy when we're forming anything. This is the formation of the first blood vessels by the precursor endothelial cells, and we call those hemangioblasts. At about day 7 of the embryonic development, we form blood islands in the yolk sac. The hemangioblasts in the center of the blood islands then differentiate into the hematopoietic stem cells. Those, of course, are what you will eventually find in blood marrow or bone marrow, and those will give rise to all your blood cells. So, hematopoietic stem cells. And what do we call the process of blood cell formation? It has that term in it, blood cell formation. Can you recall? Hematopoiesis. Okay, the hemangioblasts in the periphery become angioblasts, and they combine and they form the first blood vessels. Then the angioblasts remodel the blood islands into the primitive capillary networks, and then they become larger vessel networks. And there's really two processes involved in blood cell formation. So keep that in mind. But as we move forward, we produce cardinal veins, which are a series of venous channels that form the superior and inferior vena cava. And the aortic arches, which are a series of arterial channels that form the carotid arteries, the aortic arch, part of the pulmonary arteries. Then the dorsal aorta becomes the descending aorta. In angiogenesis, we have growth of new blood vessels from pre-existing vessels. So the dorsal aorta and the cardinal veins are formed by vasculogenesis. Any further growth of blood vessels comes from angiogenesis. There's your 4-week embryo. Now let's look at the review of the circuit. The pulmonary circuit is composed of arteries and veins that transport blood between the heart and lungs, you'll recall. So this starts at the right ventricle, it ends at the left atrium. The systemic circuit transports oxygenated blood to all your organs and your tissues. This begins at the left ventricle, it ends at the right atrium. And this should be just a review for you. This chart gives you kind of a summary of the general patterns of the blood vessel organization. Peripheral distributions of the arteries and the veins on the body's left and right sides are pretty much the same, except near the heart. In that case, the largest vessels connect to the atria or the ventricles. And a single vessel can have several names as it crosses specific anatomical boundaries. So as it says, making accurate anatomical descriptions possible when the vessel extends far into the periphery. The example I give, the external iliac artery becomes the femoral artery as it leaves the trunk and enters the lower limb. So it's still really a part of the external iliac. Tissues and organs are usually serviced by several arteries and veins. Quite often the anastomoses between the adjacent arteries and veins reduce the impact of the temporary or the permanent occlusion of a single blood vessel. So let's talk a little bit more detail about the pulmonary circuit. the arteries of the pulmonary circuit do differ from those in the systemic circuit. If we look at the pulmonary trunk, and that's the large artery that comes out of the right ventricle, it branches into right and left pulmonary arteries, and they branch into smaller arteries and pulmonary arterioles that then supply the alveolar capillaries around the alveoli of the lungs. Those are the air pockets. That's where gas exchange occurs, where you have the simple squamous epithelial cells. Then the oxygenated blood returns along the small venules that join, and they form the pulmonary veins. There's 2 right and 2 left pulmonary veins, and they drain into the left atrium. And you will recall that this is one of the examples where arteries carry deoxygenated blood and veins carry oxygenated blood. Okay, so in this picture you see the pulmonary trunk, and you see the left and the right pulmonary arteries. Remember, arteries go away from the heart, and then you see the left pulmonary veins coming back in here. Notice the pulmonary veins in this case are red, and the right pulmonary veins are red as well because they are oxygenated, the blood inside them. For the systemic vessels, in the arterial system, all the vessels originate from the aorta. They extend from the left ventricle, and most arteries are paired to left and right. The venous system, all the vessels drain into the superior vena cava from the head, neck, chest, and upper limbs, and the inferior vena cava from all the structures that are inferior to the diaphragm. So that's the trunk and lower limbs. And the arteries and veins are usually similar on both sides of the body. One difference they mention between arteries and veins is the distribution in the neck and the limbs. Also, arteries tend to be deep in the skin. They're protected by bones and soft tissues usually, which is one of the reasons why you usually don't see them very easily. Also, a significant difference between arteries and veins, the distribution in the neck and the limbs. The veins are generally 2 sets, 1 deep, 1 superficial. It's important in controlling your body temperature. So if it's hot weather and you get really hot, your venous blood flow will be more superficial. In cold weather, the venous blood flow is deeper, and that conserves heat. Looking closer at the arteries. So the branches of the aortic arch, we have 3 elastic arteries that come out of it: the brachiocephalic trunk, the left common carotid artery, the left subclavian artery. The brachiocephalic trunk branches into the right subclavian artery that goes to the right arm and chest, and the right common carotid artery. It goes to the right side of the head and the neck. So that's the brachiocephalic trunk. The left common carotid artery goes to the left side of the head and neck, and the left subclavian artery goes to the left arm and chest. Again, these are the branches of the aortic arch. Okay, branches of the right subclavian. In the thoracic cavity, you have the internal thoracic artery that supplies the pericardium and the anterior chest wall, and the vertebral artery that supplies the brain and spinal cord. Then we move to the arteries of the arm. These are a continuation of the subclavian artery. You have the axillary artery that crosses the axilla to enter the arm. You have the brachial artery supplying the upper limb. And in the upper arm, it gives rise to the deep brachial artery, which supplies the deep arm structures, and the ulnar collateral arteries supplying the elbow area. Okay, going into the forearm, again, these are branches of the brachial artery. We have the radial artery, follows the radius, the ulnar artery that follows the ulna. And then the radial and ulnar arteries actually fuse and they form the superficial and deep palmar arches, and those supply blood to the hand. Then the palmar arches branch into digital arteries that supply the thumb and fingers. Okay, and this graphic shows, again, there's the aortic arch, there's the left subclavian, left common carotid, and then the brachiocephalic trunk, and of course off the brachiocephalic. Again, you can see the vertebral. Then we go to the right subclavian. Then we have further, we start changing the name of it as it goes into different parts. Axillary, and then when it starts branching off, deep brachial, ulnar, and then down here radial ulnar, deep palmar, superficial palmar arch, and the digital arteries. Okay, the veins drain into the right subclavian vein. So keep in mind, when we talk about veins, we talk about draining areas as opposed to supplying areas, because they're coming back to the heart. So from the digital veins in the fingers, so we're going to start at the far end. So from the fingers and thumb, blood drains into the veins of the hand and forearm. So you have the deep palmar arch, it drains into the ulnar vein, the radial vein, and then the superficial palmar arch, which drains into the cephalic vein, the median antebrachial vein, and the basilic vein. You may want to follow along in your book if you have that page open. It drains into the right subclavian vein. So the cephalic and basilic veins are interconnected by the median cubital vein. And in the arm, the cephalic vein extends along the lateral side of the arm. The brachial vein merges it with the basilic vein, and then becomes the axillary vein when it enters the axilla, the underarm. The cephalic vein joins the axillary vein and forms the right subclavian vein. Okay, moving to the veins of the neck, you have the external jugular vein that drains the superficial structures of the head and neck, the internal jugular vein that drains deep structures of the head and neck, and the vertebral vein that drains the cervical spinal cord and the posterior surface of the skull. Okay, the veins that drain into the superior vena cava now, so we're coming to the heart. The internal thoracic vein, it collects blood from the intercostal veins and it drains into the brachiocephalic vein. Then the brachiocephalic vein forms at the junction of the jugular and subclavian veins. It also receives blood from the vertebral and internal thoracic veins. The right and left brachiocephalic veins join and form the superior vena cava and drains blood into the right atrium of the heart. So now we're back at the heart. Okay, so here's our diagram, our picture. We're starting at the digital veins, work our way backwards into the major ones, which are the median antebrachial, and we include the ulnar, basilic, radial, cephalic. Then we have the junction of the ulnar and the radial veins. We move our way into the median cubital. Then we move into the upper arm where we have the brachial and cephalic. Further up, then we reach the axillary at the underarm. Then we drain into the right subclavian. Then you see the external jugular here. I'm sorry, here where we drain from the neck. So I was pointing the wrong place. The vertebral vein coming in close to where the brachiocephalic is, and the internal jugular coming in. But we really say they're coming in at the right subclavian. It doesn't become the brachiocephalic really till after the internal jugular. And eventually the superior vena cava. Okay, let's look at some specific arteries. The common carotid artery, which we have shown, it supplies blood to the face, neck, and brain. It branches into the external carotid and the internal carotid. The external carotid artery supplies the neck, the esophagus, the pharynx, the larynx, the lower jaw, the cranium, and face on that side. And the internal carotid artery supplies the brain and eyes. The carotid sinus at the base of the internal carotid contains baroreceptors, and that's an important point for monitoring blood pressure. And then the vertebral artery from the subclavian artery moves upward in the transverse foramina of the cervical vertebra, and the left and right vertebral arteries enter the cranium at the foramen magnum. That's the large hole, bottom of the skull. They fuse to form the basilar artery along the ventral surface of the medulla oblongata. Okay, so here's our picture showing the branch off the brachiocephalic going to the common carotid. Then you see in this picture to the right the external carotid that then branches further into other major arteries. To the left you see we branch into the carotid sinus that goes more internal into the internal carotid. Okay, the veins. The external jugular veins formed by the maxillary and temporal veins. It drains the cranium face, the lower jaw, the neck on that side, and the internal jugular vein drains the cranial venous sinuses. It exits the skull through the jugular foramen. The vertebral vein drains the cervical spinal cord and the posterior skull surface, passes through the transverse foramina of the cervical vertebrae. The external jugular and the internal jugular and the vertebral veins then merge with the subclavian vein and form the brachiocephalic vein. Okay, so again, when we talk about veins, we kind of work our way backwards. And you see they all eventually reach to the brachiocephalic, right or left. But the ones that feed directly into the brachiocephalic are external jugular, internal jugular. Okay, let's talk specifically about some of the major arteries. The internal carotid arteries supply the anterior half of the cerebrum. And the branches of the internal carotid include the ophthalmic artery that goes to the eyes, the anterior cerebral artery that goes to the frontal and parietal lobes of the brain, the middle cerebral artery that goes to the midbrain and lateral surfaces of the cerebral hemispheres, and then the vertebral and basilar arteries supply the rest of the brain. And those are shown here. Again, these are branches of the internal jugular and vertebral arteries. That should be internal carotid. Did you catch that? What is jugular? Is jugular an artery? Okay. Cerebral arterial circle, circle of Willis. ring-shaped anastomosis. It's formed by the internal carotid arteries and the basilar artery. It encircles the infundibulum of the pituitary gland. The arrangement reduces the likelihood of serious interruption of the cerebral blood flow. And the basilar artery divides into the posterior cerebral arteries, then branches into the posterior communicating arteries. Okay, so looking at the bottom of the brain, we see the major arteries there. Again, notice the major arteries that are the main supply from which the other arteries branch off of. There's the internal carotids. Okay, moving back to veins. Superficial cerebral veins and small veins of the brainstem drain into a network of dural sinuses. And the superior sagittal sinus is the largest dural sinus. Deep cerebral veins then drain into the great cerebral vein. And the great cerebral vein drains into the straight sinus. The other small cerebral veins and the veins from the orbit drain into the cavernous sinus. The vertebral vein, it receives blood from the transverse sinus, the occipital sinus, superficial veins of the skull, and the veins that drain the cervical vertebrae. And that's shown here. And again, you see the major veins to which these veins drain to. There's the internal jugular, there's the vertebral. I want to say, keep in mind, even though I'm going over a lot of detailed veins and arteries, the ones to focus on are still the ones in the list of arteries and veins to know that you've been given. And anything extra that I've got on the study guide. Okay. Cavernous sinus empties into two petrosal sinuses, and they drain into the transverse sinus. Then the sigmoid sinuses are formed at the convergence of the transverse sinus, the straight sinus, and the superior sagittal sinus. They penetrate the skull to jugular foramina as the internal jugular vein. Back to arteries. The descending aorta continues from the aortic arch. The diaphragm divides the descending aorta into the thoracic aorta and the abdominal aorta. And we can go to the somatic branches of the thoracic aorta, which include the intercostal arteries that supply the chest muscles and the vertebral column, and the superior phrenic arteries that supply the superior surface of the diaphragm. The visceral branches of the thoracic aorta, which supply the organs of the chest, include the bronchial arteries that supply the lung tissues that are not involved in gas exchange, the esophageal arteries that supply the esophagus, the mediastinal arteries supplying the tissues of the mediastinum, and the pericardial arteries that supply the pericardium. Those are shown here, along with some others. The major paired branches of the abdominal aorta include the inferior phrenic arteries that supply the inferior diaphragm and the esophagus, the adrenal arteries that supply the adrenal glands, the renal arteries that supply the kidneys, the gonadal arteries that supply the gonads, of course, the testicular arteries in males, ovarian arteries in females, and the lumbar arteries that supply the vertebrae, spinal cord, and abdominal wall. The major unpaired branches of the abdominal aorta, the celiac trunk, and there are 3 branches. The left gastric artery, this is to the stomach and inferior esophagus. The splenic artery to the spleen and stomach. Common hepatic artery, this is arteries to the liver, stomach, gallbladder, proximal small intestine. The superior mesenteric artery for the pancreas, duodenum, and most of your large intestine. And the inferior mesenteric artery for the colon and the rectum. Okay, now to the veins. The superior vena cava drains blood from the head, neck, shoulders, chest, and upper limbs. Major collecting vessels of the trunk. The azygous vein, which is a major branch of the superior vena cava. The hemiazygous vein, which drains into the azygous vein and may drain into the left brachiocephalic vein. And drainage into the azygous vein and hemiazygous vein comes from the intercostal veins, from the chest muscles, the esophageal veins from the inferior esophagus, the bronchial veins from the passageways of the lungs, and the mediastinal veins from the mediastinal structures. Again, we're working our way backwards. The inferior vena cava collects most of the blood inferior to the diaphragm. The major tributaries of the inferior vena cava are the lumbar veins. This is the lumbar portion of the abdomen. The gonadal, again the ovarian or testicular. The hepatic veins from the liver. The renal veins from the kidneys. And those, by the way, are the largest branches of the inferior vena cava. Major tributaries of the inferior vena cava continue here. The adrenal veins from the adrenal glands, and then the phrenic veins of the diaphragm. They're only the right phrenic vein drains into the inferior vena cava, though. The left phrenic vein drains into the left renal vein. Okay, the arteries. The celiac trunk, it divides into the common hepatic artery, the left gastric artery, the splenic artery. And then we have branches of the common hepatic artery, which include the hepatic artery proper for the liver, the cystic for the gallbladder, the gastroduodenal for the stomach and duodenum, the right gastric for the stomach, the right gastroepiploic for the stomach and duodenum, and the superior pancreatic, I'm going to have to try that one again, pancreaticoduodenal for the duodenum. The superior mesenteric artery supplies the pancreas, duodenum, small intestine, most of the large intestine. With these particular branches, the inferior pancreaticoduodenal, which is pancreas and duodenal, the right colic, which is a large intestine, the ileocolic, which is large intestine, middle colic, the large intestine, and the intestinal arteries, the small intestine. The inferior mesenteric artery supplies the terminal portions of the colon and rectum and has 3 branches. The left colic for the colon, sigmoid, again colon, the rectal for the rectum. And then we have branches of the splenic artery, which include the left gastroepiploic for the stomach and the pancreatic, which is the pancreas. And all of those are shown there. Moving to the veins in the similar areas. The hepatic portal vein is formed by the fusion of the superior mesenteric vein that carries the largest volume of the blood, most of your nutrients, the inferior mesenteric vein, and the splenic vein. And this one also receives blood from the left and right gastric veins and the cystic vein. The circulatory pattern is called the hepatic portal system. This directs blood with the absorbed nutrients from the digestive system to the liver for processing. And I think this is a less well-known fact of how nutrients are processed. Branches of the hepatic portal vein include the inferior mesenteric vein, the splenic vein, and the superior mesenteric vein. Branches of the superior mesenteric vein include the pancreatic duodenal, the middle colic for the transverse colon, the right colic for the ascending colon, the ileocolic for the ileum and ascending colon, and the intestinal for the small intestine. Branches of the splenic vein include the left gastroepiploic for the stomach, the right gastroepiploic for the stomach, the pancreatic, and then branches of the inferior mesenteric vein including the left colic descending colon, sigmoid for the sigmoid colon, and the superior rectal for the rectum. And by the way, let me say that right. It should be pancreatico-duodenal. Pancreatico. Arteries, continuing. The abdominal aorta then divides to form the right and left common iliac arteries. Each common iliac artery branches into an internal and external iliac artery. The internal iliac artery supplies the urinary bladder, internal and external walls of the pelvis, external genitalia, medial side of the thigh. In females, it also supplies the uterus and vagina. The external iliac artery, when it goes into the lower limb, it becomes the femoral artery. The femoral artery then branches off to form the deep femoral artery, and the deep femoral artery forms the femoral circumflex arteries, which supply the ventral and lateral skin and the deep muscles of the thigh. The femoral artery changes its name to the popliteal artery, posterior to the knee joint. And then the popliteal artery branches and forms the posterior tibial artery that gives rise to the fibular artery, and it's also called the peroneal artery at this point. The anterior tibial artery, at this point we have a descending genicular artery, which is another branch off the femoral artery. Arteries of the foot, these supply the distal portion of the foot, the digital arteries of the toes, and the tibial and fibular arteries interconnect by the anastomoses of the dorsal pedis, the dorsal arch, and the plantar arch. And do notice that the major artery coming out of the pelvis, it's common iliac at the top portion before it goes into the hip, and once it comes into the hip and we have the internal iliac to branch off of it, that's when we start calling it the external iliac. And then once it goes down into the thigh, we start calling it the femoral. That can get a little bit confusing. But notice we call it femoral all through the thigh. Okay, the veins in this area. Plantar venous arch delivers blood to the deep veins. So we have the anterior tibial, posterior tibial, and the fibular or peroneal. The dorsal venous arch collects blood from the capillaries on the superior surface of the foot and digital veins of the toes. It drains into the superficial veins, the great saphenous vein, and the small saphenous vein. The small saphenous vein then merges with the popliteal vein at the knee and forms the femoral vein. And then the femoral vein receives blood from the great saphenous vein, the deep femoral vein, which drains from the deeper structures of the thigh, and the femoral circumflex vein, which drains the regions around the neck and the head of the femur. The femoral vein penetrates the body wall, then becomes the external iliac vein once we get in the pelvic cavity. The external iliac veins receive blood from the lower limbs, the pelvis, and the lower abdomen, and the internal iliac veins drain the pelvic organs. This is formed by fusion of the gluteal, the internal pudendal, the obturator, and the lateral sacral veins. And at the inner surface of the ilium, the external and internal iliac veins fuse, and this forms a common iliac vein. Okay, this is a good chart to look at for where certain parts of your body are supplied with blood. And it also gives you a route. So if you're someone that's a little bit more visual, this might be a good one for you to look at as opposed to simply reading the text. This is the blood supply to the systemic circuit with many other arteries included, going down into the abdominal areas. And this works its way further down into the common iliacs. Here we have a diagram showing blood return from upper limbs. So here's the veins. Again, just a different version to help you remember. Thoracic blood return to the heart. And blood return from the abdomen and pelvis. Here's blood return from the lower limbs. Okay, let's look at this clinical module. So fetal circulation. You have umbilical arteries. These are pairs of arteries carrying blood from the fetus to the placenta that run from the internal iliac, let me try that again, internal iliac arteries into the umbilical cord. And then the umbilical vein, they carry blood from the placenta, they bring oxygen and nutrients, they drain into the ductus venosus. All the umbilical vessels do degenerate after birth, but there's still some remnants that we call the fibrous cords. The ductus venosus, this is the vascular connection to the veins within the liver. It collects blood from the liver and from the umbilical vein. It empties into the inferior vena cava. The foramen ovale, also called the interatrial opening, allows blood to pass from the right atrium to the left atrium. It bypasses the pulmonary circuit. It just has a one-way valve that prevents backflow. And keep in mind, this is just fetal circulation. And then the ductus arteriosus, this is a bypass between the pulmonary trunk and the aorta. It sends blood from the right ventricle to the systemic circuit. Any of the changes we see in circulation at birth are going to be because of expansion of the pulmonary blood vessels that result in pressure changes. And any increase in pressure in the left atrium is going to cause closure of the foramen ovale. And you do still see a remnant of the foramen ovale. It's a shallow depression we call the fossa ovalis. Eventually, rising oxygen levels cause the ductus arteriosus to constrict and close. And you still see a remnant of the ductus arteriosus. It's a fibrous cord we call the ligamentum arteriosum. Let's talk about some problems though. There's some congenital defects, ventricular septal defects. Openings in the interventricular septum may occur. It's the most common congenital heart problem we see, affecting about 0.12% of newborns. And what happens is a mixing of oxygenated and deoxygenated blood between the ventricles. Then there's patent foramen ovale. In this case, the passageway remains open. Blood recirculates through the pulmonary circuit, and it's a left to right shunt. Normal oxygen content occurs, but the left ventricle has to work harder to get adequate systemic flow. In patent ductus arteriosus, the passageway remains open. It's a right to left shunt. The blood is not adequately oxygenated, and the skin will be bluish in the child. Tetralogy of Fallot. This is a complex group of defects. About 0.10% of newborn infants have this. And the 4 defects involve pulmonary trunk being abnormally narrow, also called pulmonary stenosis. The interventricular septum may be incomplete. An aorta may originate where the interventricular septum normally ends, or the right ventricle is enlarged. In that case, both ventricles thicken because of the increased workload. An atrioventricular septal defect, both the atrium ventricles are incompletely separated, and there's different results. It could affect atrioventricular valves, and this most commonly affects infants that have Down syndrome. Transposition of the great vessels may occur. The aorta is connected to the right ventricle. Pulmonary artery is connected to the left ventricle. This affects about 0.05% of newborn infants. Okay, make sure you go back through. This chapter has lots of details in it, as you can imagine. I think the diagrams in particular will be very helpful in remembering some of this information.